Good afternoon, everyone. We'll get started. Today, we'll hear from Mayor Tom Barrett, Milwaukee County Executive David Crowley, Dr. Ben Weston, Director of Medical Services for the Office of Emergency Management, Darren Rausch, Health Officer and Director for Greenfield Health Department, Brian Drancic, Airport Director for the Milwaukee Mitchell International Airport, and Tony Snell Rodriguez, Vice Chair of the City of Milwaukee Equal Rights Commission. Thank you all for joining us, and Mayor Barrett, we'll start with you.
Thank you very much, Catherine, and good afternoon, everyone. Thank you for joining us today as well. I want to talk just a few seconds about the Democratic National Convention, because the decision to make some significant changes with the convention was driven almost exclusively, if not exclusively, by the public health concerns that are present, not just in the city of Milwaukee or the state of Wisconsin, but throughout the nation. Because as we're seeing around the nation, particularly in the western states and the southern states, we're seeing a surge of new cases, particularly in those states that have opened up rather extensively. And so there is a lot of concern. I know on the East Coast, for example, you're seeing New York and New Jersey that are looking at quarantining people from 9 different states as they travel to those regions. So I think the whole notion of traveling among states in the next few months is going to remain a very, very hot topic. And after conferring with public health experts at the national level, the state level, and the local level, the Democratic National Committee made the decision that it would ask the delegations to stay at home and not travel to Milwaukee. Now, that does not mean that there won't be a convention. It just means that it's going to be a smaller convention. It will no longer be held in the Pfizer Forum. Instead, it will be held in the Wisconsin Center, which is a significantly smaller venue. And there will not be as many delegates. There might be some delegates, but we don't anticipate that we are going to have the 50,000 visitors that we had hoped to have in this historic event. But I think we have to put this in perspective. And the perspective, of course, that we have been talking about for the last 3 months is here we're sitting with over 120,000 people in this country who have died from COVID-19. And unfortunately, the estimates that we're hearing from our public health experts is that that number is going to continue to grow in the foreseeable future. And the message that we have been pounding for several months now is that people need to be careful. And I think that this is just another sign of the changes that are occurring that we never anticipated, that none of us ever anticipated when we first started talking about this earlier this year. So as much as it's a disappointment for businesses here, and it's a personal disappointment for me, I certainly understand the decision, and it's my hope that we do the best we can. We're still going to be the place where this convention is being held, although again, it's not going to be what we had anticipated when it was announced in March of last year. But there's a lot of things that we're doing that are keeping us very, very busy, and just in the next 24 hours, we're continuing our aggressive outreach through our webinar series. And tonight at 6 o'clock, we'll be having a webinar outreach with childcare providers. And we'll have representatives from the health department, from the medical college, from the Wisconsin Early Childhood Association, with healthcare, with childcare providers. So they have a sense of best practices, what they can do, what they shouldn't do. And we look forward to having people join us for that. If you're interested in that, you can simply go to milwaukee.gov/MMFS, which stands for Moving Milwaukee Forward Series, and that will allow you to get the link to come and listen to that. Again, it starts at 6 o'clock. I think it's 6 o'clock. Check the time. I don't want to give the wrong time this evening. Tomorrow morning at 9 a.m., we'll be doing a similar one for faith leaders, and we'll have Pastor Lanier. We'll have, again, representatives from the medical college and the health department talking about church services specifically and steps that can be taken, but also talking about the challenges that the faith community faces. When I've looked at different categories of events that can be high risk, church services, perhaps surprisingly for some people, is continuously near the top of the list. And I think it's not only because of the interaction, but maybe because of the traditions of the church or the faith practices that are there, the singing that occurs, the amount of communication, sometimes the hugging that occurs. I think all those are things that we want to make sure that people know what the risks are, because the risks are still very, very real. So we remain very, very busy at the local level. And we're going to continue to do everything we can to make this a safer summer for everybody. So with that, I'm going to turn over to County Executive Crowley to talk a little about things from the county perspective. County Executive.
Thank you so much, Mayor Baird, and welcome everybody and good afternoon. I will start off like I do most days to talk about what's happening with our National Guard testing sites here in the community. And while UMOS and Custer Stadium are still open and have plenty capacity, we do have to start planning for what is happening next. And I'm extremely thankful for what the National Guard how they have supported us over the past few months. But we know that they won't be here forever. And so we know that we will still be fighting this pandemic long into the future. So as we approach July 1st, I want us to start thinking about making sure that we start caring about our whole self and making sure we encourage people to find a healthcare provider that offers a full continuum of care. So if you don't have a provider, I highly encourage you to call Impact 211, and they will work with you to provide a provider that can meet your needs and fits your situation. And so here in Milwaukee, we believe that we have equitable healthcare access to everyone. That's affordable, that's high quality, cultural, linguistically appropriate for folks who live here because of our diverse background. And we just want to make sure that we are empowering everybody to use these resources. Again, you can call 211 if you're looking for a provider. The other thing I want to make sure that we touch on briefly is I want to say thank you to Judge Triciano for joining us early this week on Tuesday to remind folks that the courts will be opening up. We're going to begin summoning jurors as early as next week to prepare for in-person trials starting on Monday, July 20th. And so we've been working closely with health consultants to redesign our courtrooms to adhere to CDC guidelines to make sure that people feel safe when they come here. We want to make sure that we open up our courtrooms. People deserve to have access to a fair and speedy trial. And many of these requests have been delayed because of COVID-19. So we want to make sure that we're looking at everything here within the county courthouse to make it safe, to make it clean, sanitized. And again, we want to continue to encourage folks to wear their masks because we want to make sure that we're making all of our decisions here in Milwaukee County based on the data that we see. The other thing is that we do today have Brian Dranzik from the Milwaukee Mitchell International Airport. He's the airport director, and he is joining us today. And so many people don't realize that the airport is a Milwaukee County facility. And so Brian is going to talk to us about safe traveling tips and what to expect as people go through our airport here in Milwaukee. And I last and not least want to thank Tony Snell Rodriguez for joining us to speak about Pride Month and local activities taking place this weekend. We've talked a lot about racial equity on these briefings as it relates to COVID-19, but it's extremely important to remember that the social determinants of health are based on equitable treatment and care for everyone. And this goes beyond race. We're talking race, we're talking about income, we're talking disabilities that people may have. We just need to make sure that we're doing everything that we can. And while we do that, it's important that we continue to make decisions through a racial equity lens. And that's one of the things that we're doing here in Milwaukee County. I have been meeting internally with folks, externally with elected officials and community groups so we can continue to challenge ourselves, but everybody else as we look at our policies and procedures. And to be honest with you, change is definitely necessary to make sure that we have an equitable system. We have seen the protesting. But we've also seen how COVID-19 has also exacerbated many of the things that we see here in Milwaukee County. So it's extremely important that we continue to build a table that has more diverse voices that we can continue to uplift and bring their perspectives to the table to make sure that they are represented. So that's all that I have. And so I'll kick it off to Dr. Ben Weston.
Thank you, Mr. County Executive. Good afternoon. First to our numbers, we have 10,736 confirmed cases of COVID-19 in our community and 344 individuals who've died. As we look at what is happening in various states around the country and work to understand the current and future status of COVID-19 in Milwaukee County, there's a lot of questions that have come up about testing. So while it's certainly true, of course, that the more people we test, the more cases of COVID-19 we will discover, there's much more to that line of discussion. So while testing finds more cases, it certainly and obviously does not create more disease. In fact, with increased testing, particularly testing of the right individuals and communities, we can find cases of COVID-19 that may not have otherwise been discovered. So we can then message to those individuals the importance of staying home from work, the importance of isolating from family members, and the importance of monitoring for worsening symptoms with a plan in place should those symptoms occur. Moreover, finding these cases of COVID-19 allows for our health departments to go to work in contact tracing, warning those with whom individuals have had close contact that they may be at risk and they should carefully monitor for disease. These are the methods in which we slow the spread of COVID-19. These are the ways in which we make sure that a worker, be it a factory worker, an office worker, a teacher, a nurse, does not spread COVID-19 throughout their workplace. So certainly increased testing means finding more cases, but they're cases that are critical to find to ensure that we're able to use all the tools at our disposal to fight the spread of COVID-19. As the county executive mentioned, we're working as a community to ensure that we have a long-term plan and approach to testing, that we have a method to ensure that we increase our testing capacity and are testing in a strategic and equitable manner to minimize disease and illness. So take ownership of your health. If you have symptoms or if you have concerns that you have COVID-19, get a test. It's as easy as dialing 211 to get the process started. Together, we can work toward ensuring that our community continues on a path toward better health and better wellness. Thank you and stay safe. And I will hand it, I believe, to Darren Rausch. Yep.
Thank you very much, Dr. Weston. Good afternoon, everyone. I'm Darren Rausch from the City of Greenfield Health Department, and it's my pleasure today to provide a data update from the COVID-19 Epidemiology Intelligence Unit. Excuse me. I'm going to go ahead and share my screen, and I will walk through this week's data with everybody. So this full report will be available to reporters through Catherine immediately following this meeting. As Dr. Weston mentioned, we are up over 10,000 cases. I think we crossed that threshold last week. We have an excess of 95,000 tests that have occurred in Milwaukee County residents since the beginning of COVID-19. We follow many things in these weekly epidemiological reports, and first we'll look at cases. Cases have been very important to follow in addition to other metrics, and cases continue to decrease in Milwaukee County. You can see here on the screen we had a peak in mid to late May, and we have been on a downward trajectory ever since. Just a quick frame of reference here. Yellow, gold, orange bars are daily incidents or daily new cases in the city of Milwaukee. The blue portion of the bar is daily new cases in the suburban communities, and the orange line is indicative of the 7-day rolling average for the city of Milwaukee. So we see a very pronounced decrease in the city of Milwaukee in terms of cases, a little bit less noticeable among the suburban populations, but still we are trending in a downward direction overall since late May. When we look at deaths, again, the story here is we are moving in a downward trajectory. We peaked with deaths, it appears, in early April, and we've been largely on a downward trend in both the county and the city. But we do see that there was a peak, another little slight peak, as we've been on a downward trend in late May with deaths, both in the city and the suburban communities. So two positive things are happening both in terms of cases and deaths. We have been tracking the growth rate for some time, and one of the indicators that we followed is doubling times. And you'll see here on this particular figure, we have significantly longer doubling times of COVID-19 disease in both Milwaukee County and the city of Milwaukee as compared to the state. The current doubling time in the state is about 31 days. For Milwaukee County, it's almost double that at 57 days. And the city of Milwaukee is just slightly lower in terms of 50 days doubling time. So we have really slowed the spread of COVID, that we're not doubling our numbers in days and weeks as we had early in the outbreak. Further, we have been following the reproductive number or the transmission rate. So on the screen now, I show you at the top Milwaukee County's transmission rate, and the bottom is the city of Milwaukee's transmission rate. And just to orient everybody, this particular number is calculated as a way to track the transmissibility of COVID-19. And a value of 1 indicates suppression of the outbreak, meaning that a positive case is infecting less than 1 individual in the community. So while the story has been since late May, we've largely had a transmission rate under 1. We have noted a couple blips in both late May as well as recently within the last week, where we have nudged up to and slightly past 1.0 for our transmission rate. And that's a little bit more pronounced in the county than in the city, but the trends are generally the same. So we want to keep that transmission rate low. We have tracked demographics, and I will flag those for you here. We continue to see that the 18 to 39-year-old population is having some of the largest increases of cases, but we are seeing some increases also in the under 18 population. And the data team did meet yesterday and is continuing to look at ways to continue to hone in on those pieces of information and look at those trends. It does appear that as the county has become more open starting in mid-May, that cases amongst those under 18 and those 18 to 39 have increased pretty significantly, as well as a slight increase for those 40 to 59. So we're going to continue to follow that closely. Notably though, while we have some of the most cases in the youngest age group, I would be remiss to say that the rates of disease are still highest amongst our older populations. So our older populations, those over 80 and those in the next younger age group between 60 and 79, continue to have some of the highest rates and are most at risk for significant complications, hospitalization, and death. So we want to continue to keep our older populations safe. Continuing a trend that happened over the past couple months, the Hispanic population COVID cases continue to climb, and they've surpassed the rate of other subpopulation groups. Currently, the incidence rate, or the rate of new cases in the Hispanic population, is 2.5 times greater than the rates indicated and calculated in the African American and Asian communities. And again, we continue to see lowest income populations having the most disadvantages and the most cases of COVID-19. Next, I'm going to talk about testing coverage, because certainly that has been a big focus of some of our conversations over the last several weeks. We want people to get tested so we know the current burden of disease in our community. And these 3 figures support the testing story. We had a high number of tests in week 9, as indicated by some of the National Guard testing that was ramped up throughout the city of Milwaukee and other parts of the county. Our data has improved, so only the last week's data is still pending as we continue to get negative test results put into the system. But we had a really nice uptake of testing because of some of the delays in getting testing in week 9, and we've kind of leveled off over the last 4 weeks between weeks 10 and 13. Again, testing is certainly very important as we continue to address COVID in our community. We have been following not only the total number of tests, but also the daily percentage positive tests. And in figure 14, we see how that trajectory has changed over the last few months. And then most importantly, we see a 14-day trend here in the lower right. Unfortunately, I report today that that 14-day trend is increasing, and that is a statistically significant increase. So that is of note over the last 14 days that we have been increasing the number of cases of COVID, hence the reason that we have these media briefings and are really encouraging testing, staying safe, wearing masks, all of those sorts of personal protective measures. Lastly, I will end by showing you 2 maps. This is the spatial map of all cases of COVID in Milwaukee County. And again, the story is COVID is rampant and has been rampant over the last 3+ months throughout Milwaukee County. And more specifically, over the last week, we see continued localization of COVID transmission and case finding in the southern part of Milwaukee City. But it has expanded even broader in this last week into some of those southern suburbs. We see a yellow spot down here in Cudahy, as well as some more identification of cases on the north and northwest sides of Milwaukee. So folks, disease is still out there. Disease is still running rampant in our community, and it's been actually increasing. So I implore all of you to continue to do your part in limiting disease spread. Stay home when you're sick. Continue to consider physical distancing whenever possible out in public, and wear your face mask not only to protect yourself, but others around you. Thank you very much, and I'll turn it back over to Catherine.
Thank you, Darren. We appreciate it. Now we'll hear from Airport Director Brian Dranzik.
Good afternoon, everyone. Again, Brian Dranzik, Airport Director at Milwaukee Mitchell International Airport. Just want to give you a sense of what's been happening here at the airport. We have, over the last month or so, seen a return of passengers to the airport from our historically low levels. And with that, we want to just reassure people what we're doing and reemphasize what travelers need to do as they go through their travel experience. So from the start of the pandemic, we've intensified our cleaning efforts here at the airport, disinfecting public spaces, doing things like deep cleaning our restroom areas, our surface areas, and installing hand sanitizer stations, both pre and post security, and upgrading some of our restroom fixtures to touchless fixtures, either faucets, soap dispensers, towel dispensers, things of that nature, to again, make sure that we have as few touch points as possible. And others like TSA and airlines have also intensified their cleaning protocols. You may have seen this in other sources. Areas like ticketing, the ticketing area, the boarding areas, the TSA screening process itself, all are moving towards a contactless system. Travelers also have a stake in everyone's collective well-being as well. First, like you've heard others message, if you're sick or symptomatic, please do not travel. The airlines have relaxed cancellation and rebooking fee policies. Please take advantage of those offers and rethink your travel needs. When you do come to the airport, always wear a face mask or face covering of some sort while at the airport and on board the aircraft. We see people that have come through the airport and maybe they're just uncertain of the policies or the procedures, and they think that the TSA checkpoint area is the place to start wearing a mask. Really, it starts when you enter the facility. So please always wear a face mask when you're in the airport facility and throughout your journey. Also, like in other cases throughout the community, maintain social distancing to the greatest extent possible. Avoid congregating in areas such as the baggage claim carousels. You know, everybody wants to grab their bag when it's coming off the carousel, but give some distance and give yourself some room. Check into your flight at home or use a mobile device that avoids going through more areas of the airport. And if you're picking up or dropping off a passenger, you can remain in your vehicle. We've got not only the cell phone lot where the person that's coming in and arriving that you're picking up, they can contact you, you can pull it to the curb and go from there, or use the hourly parking lot. For the first half hour, it's free. That's another place where you can pick up somebody that's arriving from their destination. With this slight increase in traffic, and it is relatively slight, but still meaningful, our numbers have gone up to about 2,400 people a day, down from what we normally experience of about 12,000 or so a day at this point in time. Things are starting to regenerate a little bit. So the airlines have policies right now, most of them, where they're not providing food or beverage service. So some of our restaurants and shops are reopening. They'll be opening going into this weekend. And also our Super Saver lot will be reopening. We closed that lot down temporarily to avoid shuttling and things like that, and used our surface lot that's closest to the airport for the Super Saver lot. Due to now the fact that that lot's getting to capacity, we're reopening the Super Saver lot, so be aware that change is coming. Really, what we want to emphasize in the end here is that if you need to travel, if you've chosen to travel, we're doing everything that we can to maintain a safe and comfortable experience. And we're asking that you do your part in making that experience the same for you and your fellow travelers. Please follow all the protocols that you've been hearing about. Wear face masks, social distance, rebook if you have to. But if you're going to come to the airport, we're doing what we can to maintain that positive experience for you. So I'd like to thank County Executive Crowley and Mayor Barrett for the opportunity to speak today. And I'll turn it back over to Catherine.
Thank you, Brian, for those tips and sharing those updates. We'll now hear from Tony Snell.
Hello, everyone. Mayor, County Executive, everyone on the call. On behalf of the Equal Rights Commission and the LGBTQ community, it's a pleasure to be here to honor Pride Month. Each year in June, countries across the globe and cities across Wisconsin celebrate LGBTQ Pride Month with parades and marches and celebrations. You've seen them, including right here in Milwaukee with Pride Fest. This year, those events have been either postponed or moved online to help prevent the spread of COVID-19. LGBTQ Pride Month is celebrated annually to honor the 1969 Stonewall riots and works to achieve equal justice and equal opportunity for LGBTQ people. Central to the story of Pride is that of Black trans activist Marsha P. Johnson. Her fearless advocacy for LGBTQ rights and her role in the New York Stonewall riots set the stage for a decades-long fight for justice and our movement. Her bravery inspires all of us every day. With regard to COVID-19, LGBTQ people are at greater exposure and risk of both economic and health complications than non-LGBTQ people because of the types of jobs they are more likely to have, because of their experiences with poverty and lack of paid leave, and because of the health disparities compared to non-LGBTQ people, and considering the higher rates of isolation and homeless youth. There is opportunity and resources here locally for individuals. I put them up in the chat a little bit early, hit the enter button rather quickly, but I wanted to share local organizations that have resources and support groups available in person and virtually. The Milwaukee LGBT Center, Diverse and Resilient, Forge, Courage House, among others. One thing we can do is continue to honor and celebrate Pride. And you know, in this space right now, even with, in this and honoring the space that we're in now, we honor Pride. The LGBTQ communities around the world will virtually celebrate Global Pride this Saturday, streaming a 26-hour event across the world, hosted by the incredibly talented Todrick Hall, who you may remember headlined Milwaukee Pride a few years ago. Folks can go to globalpride2020.org to join the celebration. And remember, it's LGBTQ+, and that plus includes allies. That's everybody that supports us, and we come together and we will honor Pride together. Thank you for this opportunity. On behalf of all of us at the City of Milwaukee Equal Rights Commission, it's a pleasure to be here.
Thank you so much, Tony. We really appreciate it. We will now move to the portion of the question and answer from media. Our first question comes from Mary Jo Ola with Team J4, and it's for Dr. Ben Weston and Director Roush. She asks, as school districts continue developing plans for the new school year and considering how COVID-19 spreads, is it safe to bring students and staff back to the classroom in a couple of months? And what about the added concern that schools will be held liable if someone gets sick with COVID-19?
So I can take a first stab at this. I think everything that we open up, there's always a balancing act of, is it safe enough? Should we get back to normal? Obviously, schools fall right into that category. I think for everyone with children, I think we know that it's important for them to go to school. It's important for the socializing, for the education. And so I think there are safe ways to go back to school. I think the document released by the DPI is a great start. I think it's a great guide on how schools can implement various practices, various classroom types, combining virtual and in-person and different models to achieve that. Obviously, it's up to each school and each district to do it. I think it's important for districts to consider this very carefully. We never know where the next spike in COVID is going to be. It could be in a community that has experienced it, or a community that has had almost no COVID so far. So I think it's vital for every school to consider this and to take it into account. And then I think for policymakers and decision makers, it's important to ensure that it's equitable. We know that schools, certain districts, certain communities get left behind, historically get left behind for years and decades. And so it's important with this in particular to put those schools first and prioritize those schools as we work toward planning to keep our kids safe.
Yeah, and I would add, and I would echo all the sentiments that Dr. Weston shared. Obviously, any decision made to reopen anything, whether it's bars, restaurants, salons, has been carefully weighed by the public health folks throughout not only Milwaukee County, but the state. The Department of Public Instruction worked closely with the Department of Health Services at the state to create a framework, and that framework is now in the hands of our school officials. And health officials like myself and many of my colleagues throughout the county and the region are working closely with those schools to find the exact mechanism and the exact model that they can use to reopen safely in the fall. And there's going to be lots of discussions about that in the coming weeks so that we can have a plan moving forward as soon as possible.
And as we talk about reopening, Derek Rose with WISN 12 has a question. He asks us to Mayor Barrett and County Executive Crowley, and certainly health officials feel free to weigh in. It's a twofold question. The first is, we've had the highest statewide spike in a couple of weeks. Is there any concern we may be opening too quickly, and any thoughts on slowing down the reopening process? The second question is, are there any plans or discussions to mandate masks in public?
I can take a shot at we have had conversations about masks, and I'm going to allow the health commissioner from the city of Milwaukee to talk a little bit more in depth about that. As we look at a new policy potentially for restaurants reopening, that's clearly one of the portions of the conversation that we have had. As we've talked about it, it appears that in other parts of the state and the country, if that is something that's been promulgated by the health commissioner as opposed to the political body, it's run into more court challenges. So it is something that we are looking at. Again, it's tied to the increases that we're seeing both locally and nationally. So that dovetails into the other part of the question. Of course I'm concerned. I'm very concerned with what we're seeing in California, in Texas, in Florida, in Arizona, in South Carolina. I'm very, very concerned as we see those numbers grow. And I think we all have to be mindful that this remains a very, very serious problem.
I guess I would echo also the sentiments of the mayor. I mean, we're all concerned when we're looking at what's happening and seeing the increase in positive cases all across the country. But I think when you look at masks, I mean, Milwaukee County has stepped up, and we are requiring masks in all of our Milwaukee County facilities. We do not require them in the airport or on the buses. But even with that requirement, we're also providing those masks for individuals who may not have them. So we are continuing to look at the data, look at the science behind all this, but we are taking the necessary precautions to protect those who are walking into Milwaukee County facilities.
All right, thank you both. The next question is from Mary Spacuzza with Milwaukee Journal-Sentinel. For Mayor Barrett, she asks, with COVID-19, what is the highest number of people who could come to Milwaukee for the DNC in terms of attendees and press?
Well, one of the things that I've said for several months now is that there's two things that I'm certain of. One is that the Democrats and the Republicans, for that matter, both would be holding conventions to nominate their candidates for president. That was the first statement I made that I was confident about. The second statement that I made, as it pertains to the Democratic National Convention, was that would be held in Milwaukee. And again, I remain confident about that. And I was always very careful after making those two statements to say that the key word following those two statements is the word nimble, because we really, really don't know I think it's clear that the decision to move the convention activities from Fiserv Forum to the Wisconsin Center, and the decision that the Democratic National Committee made to tell state delegations not to travel to Milwaukee sends a very, very strong message that the number is going to be significantly lower than the figure that we had hoped for when this was first announced last March. But I think, given what we have seen over the last 3 months, given the uncertainty, the Democratic National Convention has not given me a number as to what to expect. I don't think they have a number at this point. I think that there's speculation as to what it would be, but I don't think I'm in a place to say, well, let's just pull a number, because I would in essence be pulling that number out of thin air. So stay tuned.
Mayor Barrett and County Executive, this is a question for you. We've received a few in the chat, so I'll ask it a bit more general. Do you have any advice for businesses, minority-owned or event-based businesses that were planning on an economic boost because of the DNC?
Go ahead, Mr. County Executive. I'll let you take a swing at that first, and then I'll follow you.
Oh, absolutely. I think that when we look at the economics of this, I think all of us are pretty disappointed in the fact that we won't get the DNC here. And so I think that we all, one, have to continue to look at the data and the science related to the COVID-19 crisis. Many of those same businesses that wanted to see that economic boost have been hit by the COVID-19 crisis. And so I would say, one, continue to go after all of those different types of resources that are available to help your business survive. And two, continue to let folks know that you do exist. You know, things have slowly opened up. We want people to protect themselves, but it's extremely important that people understand that we just have to get through this pandemic at this moment. It's created a huge impact here in Milwaukee. Everybody was excited to see the DNC coming here, but we just have to move forward and look towards the future or how we build back better after this pandemic is behind us.
Thank you. Mayor Barrett, did you have anything additional to add?
No, I think that the county executive did a good job handling it. Again, I would say that we want to continue to have more opportunities for businesses owned by people of color. And obviously the disappointment runs throughout the entire community, but we had seen this as a great opportunity to foster small business growth, particularly for businesses owned by people of color. I would, again, ask those businesses, all businesses for that matter, to continue to look at the programs that are being offered at the federal, state, and a local level to help businesses get back from COVID-19. I think that still remains very relevant.
Thank you both. The next question is from Mark Stevens with CBS 58, and it's for Brian. He asks, is the face mask policy at the airport still a recommendation, or has it been changed to a requirement? And is there an exact date for the Super Saver parking lot to open?
Sure. The face mask policy is a highly recommended and kind of a highly recommended status. There's challenges in an environment like the airport with people coming and going from different locations and the different entry points that we've had, and that's made it put it in the place where we have it today. You know, we may have people coming in from other areas where there's different policies and things like that, and you know they're coming through. They may not be aware of what's going on in a location, be it Milwaukee or anywhere else. Similarly, we've been trying to work with the ever-changing environment with some of the airline policies and things of that. You know, while it's highly recommended, please wear a face mask in the airport when you're coming through the airport. That's really the emphasis we want to put on the recommendation for people that are traveling. And just help yourself out, help out your fellow traveler. That's our word of advice. In terms of the Super Saver lot, that opens tomorrow. So that's going to open back up tomorrow on Friday, and we'll be up and running there.
Great, thank you for the clarity. Nick Williams with Milwaukee Business Journal asks a question for Mayor Barrett, and probably you're the best person to answer this one. Can you give an update on whether the city will be moving into the next phase of reopening plans this Friday? And I guess, Darren, if you want to speak to the suburbs, maybe you can speak on
This is the afternoon when our health commissioner, Commissioner Kwok, is analyzing the numbers. So she'll be making a decision as to whether we are prepared to move to phase 4, which would be the next phase. And if it does make that decision, she will make that decision, or she'll make her announcement one way or the other tomorrow. So the decision will be made one way or the other tomorrow. That doesn't mean that it will go into effect tomorrow, but you can expect, I expect to see a decision from her tomorrow.
Yes, and in the suburban communities, we looked at the data this morning, and some of the indicators changed from green to yellow, and we still have an indicator that is red. So we will not, excuse me, we don't have an indicator that is red, but none of the indicators changed in a positive direction. So we will not be moving forward into the next phase for the next week anyway.
All right, thank you. Mark Stevens with CBS 58 has another question for both County Executive and Mayor Barrett. Given the virus increases in other states, should the state consider implementing any sort of travel quarantine for people coming into Wisconsin?
That's a decision that will be made at the state level, I assume. I haven't seen any indication that Governor Evers is headed in that direction. But again, I don't think anybody should be so fixed in their view on any of this that they're not open if things take a dramatic turn one way or the other. Again, we've seen it in the northeastern part of the country. We've seen a number of states that have done it. I think that's a question that's better directed to the governor of the state of Wisconsin.
I would echo the same comments as Mayor. I think that, you know, the governor has not had this discussion with us. I'm not sure if it's being discussed at all, but again, everything has to be on the table in order to make sure that we have a healthy community. We do know that even outside of the United States, people are talking about travel bans on Americans right now. So we have to actually look at what we need to do across the board, not only just here locally, but across this country to make sure that we're mitigating this virus effectively.
All right, our last question is just asking Mayor Barrett for a little more clarity on if a potential for a mask mandate is being looked at as part of the restaurant reopening plan. Should we expect some type of announcement about both restaurants and masks this week or next? And also, would a potential mask mandate go beyond restaurants and include every public space in the city?
That's something that we're looking at right now. I would divide it into two categories. One is the category that deals with the restaurants reopening and the conditions under which they would be permitted to reopen. And that is something that I think can appropriately be made that decision by the health commissioner. I think the question going beyond that is one that's probably better suited for the political bodies to make that decision. And that's been the trend that has been occurring nationally. So again, I would divide it between the conditions that a restaurant operates under. Those seem to fall under the jurisdiction of the health commissioner. Others probably would have to go through the political process.
Excellent. Those are the questions I'm seeing in the queue for right now. So thank you all for joining. Thank you to our guests. As a reminder, Tony Snell did put those resources in the chat for everyone. And we really appreciate your time today. Have a safe weekend, and we'll talk to everyone on Tuesday.
Thank you all very, very much.
Thank you.